So what is ablation? How laser does it? Is it like coagulation,
The way the laser works, and the reason that we use the laser, the veins that we're treating are very diseased veins. They're either so massively dilated that the valves don't meet and close off the vein, or the veins are stuck in an open position so that they don't stop blood from being pulled by gravity down to the feet. So by putting a laser fiber into the vein itself and firing that laser, it creates a steam at the very tip of the laser fiber, and of course the vein is all surrounded by numbing solution so the patient doesn't feel any of this. But that steam creates a thermal injury to the lining of the vein. It causes the vein to clot off, and then in the weeks that follow, it fibroses and closes off completely, so it can no longer push blood out to the skin and cause varicose veins and spider veins to pop up. The video that we have here today shows the steps to the procedure. Basically, it involves placing an IV catheter. We've all had an IV at one time in our life. Instead of being 2 inches long, it's probably close to 2 feet long. We numb up the skin and place the IV catheter in the vein. Then we surround the vein with a numbing solution so the patient doesn't feel a thing. That allows us to place a laser fiber to the top of the vein, and then we fire the laser as we pull it back out. Then we put some compression stockings over the leg that the person wears for about 4 weeks, and during that healing phase the vein will just fibrose and close itself off completely. So the entire procedure is done with local anesthesia. It takes about a half an hour or less, and there's virtually no downtime after. In fact, we ask people to be very active in the days following the procedure.
Wow.
The only thing that we restrict is heavy lifting, but as far as walking, jogging, regular exercise, short of heavy lifting, they can do whatever they want to.
How about those, old age stripping surgeries? How long lasted the recovery period?
Stripping was a horrible procedure. It was done in the hospital with general anesthesia. People would oftentimes have to stay for a week in the hospital afterwards just for pain control. And they'd be in quite a lot of pain actually for a month or two even after that. Not only that, but they had a 50% failure rate for all that suffering. By contrast, the intravenous laser procedure that we do today has over a 98% success rate, is virtually painless, is done in an office setting with local anesthesia. It's night and day to what it used to be.
So Dr. Heggen, what's your special message for people who are watching our video now?
Well, if you have vein disease, and you would know that by problems with pain, itching, restless legs, swelling, you can be assured that the treatment today is easy by comparison to what's been historically available. The vein disease over time only gets worse, so it's probably better to treat it sooner than later. And the good news about that is that with the advances in treatment, it's not something that you need to fear anymore because it's a pretty easy treatment.
So you are sure that you will help them 99.9, right?
Absolutely.
Great.